In 2014, Flint, Michigan switched its water source, exposing residents to lead, a potent neurotoxin. The affected community needed long-term support and a plan of action. Today, the Flint Registry uses collaboration to reduce health disparities after this big disaster. The Flint Registry is a community-based public health program that helps identify those exposed during the Flint water crisis. It connects them to services such as medical care, developmental evaluations, nutrition and educational support, and environmental remediation. It is a CDC-funded program led by the Michigan State University in partnership with the City of Flint, the Greater Flint Health Coalition, and many more local organizations. After the Flint water crisis, the Flint Registry was created in response to this environmental health disaster that disproportionately affected a predominantly Black and low-income city. Congress directed the CDC to strengthen lead prevention and support voluntary exposure registry so that Flint residents could be tracked, be better supported, and studied over time. The registry turned this mandate into action by documenting exposure, preventing re-exposure, and linking services. This program is interprofessional by design. It utilizes academic and public health, such as the CDC and MSU for funding and technical assistance. It uses local government and coalitions such as the City of Flint and the Greater Flint Health Coalition, which help align clinical care, social services, and community partners. It also utilizes clinical and community services such as referrals to pediatric and primary care, behavioral health, WIC nutrition, and early childhood developmental services. It also utilizes legal aids, home remediation programs, local hires, and community partners, all which boost community trust and participation. For marginalized families, often low income and predominantly Black, this registry reduces access barriers by proactively connecting them to services such as pediatric health, mental health, nutritional support, developmental screening, and early intervention for exposed children, improving educational and life course outcomes. It also helps prevent ongoing exposure to environmental risk reduction by linking home lead abatement referrals, plumbing and water filters, and resources for water testing. This initiative, utilizing its community, increases cultural responsiveness, which is key in communities with historical distrust of institutions after a crisis. This program has enrolled over 22,000 people and made over 35,000 referrals, which is all evidence of real reach and cross-sector coordination. Nationally, the CDC's documentation of the Flint response positions this registry as a model for long-term community-driven disaster recovery in environmental health. The Flint Registry shows how we can turn an environmental disaster into a sustained, equity-focused public health system. Thank you.